While we're waiting for others to join us, in the meantime, please write in the chat box who you are and where you're joining us from. And please also make sure that you select your language. To select a language, click on the bottom where you see the globe icon, and it will take you to the English or French channel. You can then mute the original audio. In addition, you may also select whether or not you'd like to read captions during the session. You should be seeing these captions automatically, but if not, you can select them by clicking on the icon with the 2 C's at the bottom of the Zoom screen. If you wish to hide the captions later, please select the same icon again and select Hide Subtitle from the menu that appears. These captions are generated using an automatic feature in Zoom and therefore might not be 100% accurate. On the Zoom platform, captions are only available in English at this time. So please take a few moments to introduce yourselves in the chat box, select your language, and select if you'd like to continue to read captions during today's session. We've also shared a few poll questions that we encourage you to respond to while we wait for others to join us. If you'd like to read these questions in French, the French translation has been added to the chat box. As you can see, the questions are in both English and French on the slide. Thank you again for joining today. I want to welcome everyone again to today's session. My name is Brittany Getch, and I'm a program officer on the Knowledge Success Project at Johns Hopkins Center for Communication Programs. We're going to go ahead and get started. Knowledge Success is excited to be partnering with FP2030 on this series. This is our 20th conversation in the Connecting Conversations series. And if you missed previous conversations, you can watch the recordings on FP2030's YouTube channel or read blog post recaps that include recording links on the Knowledge Success site and get up to speed. This conversation will last for approximately an hour, and we'll have an open Q&A discussion with our 3 speakers. It's being simultaneously interpreted into French, as I mentioned, and it's being recorded in both English and French. The recordings will be available in the coming days. If you haven't already done so, please select your language by clicking the globe icon at the bottom of the Zoom screen. It will then take you to the English or French channel, and you can select to mute the original audio. Just a reminder about closed captioning. You may also select whether or not you'd like to read captions during the session. You should be seeing these captions automatically, but if not, you can select them by clicking on the icon with 2 C's at the bottom of the Zoom screen. If you wish to hide the captions later, please select the same icon again and select Hide Subtitle from the menu that appears. Participants are muted throughout the duration of this conversation, but if you have questions for our speakers, please type them in the chat box as you follow along. My Knowledge Success and FP2030 colleagues will be moderating the chat box and will get to as many questions as time allows. Just a little bit about this Connecting Conversations series in case you're joining us for the first time. Connecting Conversations is a series of discussions on adolescent and youth reproductive health, hosted by FP2030 and Knowledge Success. The series has been divided into 5 themes, and we began with a look at a foundational understanding of adolescent development and health. We continued our conversations by exploring engaging critical influencers and focusing on adolescent responsive services. Our 4th theme explored reaching key youth populations. For our final set of conversations, we're taking a look at some of the emerging trends and transformational approaches in AYSRH. We are excited to continue this final set of conversations with a discussion on scaling up AYSRH programs to increase impact without affecting quality. Before I introduce today's moderator for the session, I'd like to start by reviewing the poll questions. So if we could bring those answers up. Great, thank you. The first question, when you think of scale up, what does that mean to you? The majority of you selected all of the above. So that would be expanding implementation from a particular group to a broader group in the same community, expanding implementation in a community, province, or district into another community, province, district, or nationwide, and ensuring that implementation becomes part of the existing health system or program structures and financing mechanisms. The second question, scaling up an AYSRH program effectively requires, and the majority of you selected all of the above again. So that includes financing, leadership oversight, engaged stakeholders, and monitoring and evaluation. And finally, the third question, I have effectively scaled up an AYSRH program in my work before. And it looks like the majority of you selected no, or that you were unsure. So that's really interesting, and we'll definitely touch more on that during our discussion, talk a little bit more about what makes effective scale up and how to implement it. Now, I'd like to introduce our moderator for today's session. Laura Ghiron is President of Partners in Expanding Health Quality and Access, a US-based nonprofit organization, and member of the ExpandNet Secretariat. Throughout her decades-long career, she has served at the University of Michigan, collaborated with the WHO and Latin American colleagues on the implementation of the strategic approach to strengthening reproductive health policies and programs, and worked with Chinese colleagues on the Quality of Care project. In 2003, she helped found ExpandNet, which is a global network of public health and development professionals seeking to advance the science and practice of scaling up. Since co-founding Partners in Expanding Health Quality and Access in 2005, she has jointly organized and facilitated several meetings on scaling up, edited a book of scaling up case studies, and co-authored several guides and peer-reviewed articles on scale up. In addition, she co-chaired a global community of practice on systemic approaches to scale up from 2013 to 2020. She is now chairing the Health Technical Working Group of the Global Community of Practice on Scaling Up Development Outcomes. Laura has been providing scaling up related technical support since 2007 to several major public health and other global development initiatives in Asia, Africa, and Latin America, with support from the Bill and Melinda Gates Foundation, the MacArthur Foundation, USAID, and several others. Welcome, Laura, over to you.
Thanks, Brittany. What a pleasure to be here this morning. Well, my morning, Nike's evening, Galina's evening, to really help connect these two conversations. On the one hand, advancing AYSRH, on the other, scaling up. And in my own career, we have been talking about scaling up AYSRH really for the last 30 years. So I was very interested to see that not that many of you have actually had experience with scaling up your AYSRH work. Very happily, our three speakers are doing exactly that, and I believe that's why they brought us all together, to really share some of this learning around scaling up AYSRH programming and to support all of you in your thinking about how to approach this somewhat complicated task. It's never easy to scale up, but there are particular challenges when we are working on scaling up AYSRH programming and trying to improve the health and lives of youth. So I am super pleased to introduce our three speakers. I'll start with Dr. Galina Lesco, who was born and lives in the Eastern European Republic of Moldova. She was raised in a mixed Moldovan-Russian household and speaks Romanian, Russian, and English, as many people in her part of the world do. She's an obstetrician gynecologist who has special interest in juvenile gynecology, in reproductive endocrinology, family planning, and development of youth-friendly services. In Moldova, she founded a youth-focused NGO, and she leads one of the first youth-friendly health centers in the country, which is called NEOVITA. She also, NEOVITA itself serves as a national resource center for youth-friendly health services, which is exciting, and I hope we'll hear about that. Over the last 10 years, Galina has been coordinating a Moldovan-Swiss project entitled Healthy Generation, Scaling Up Youth-Friendly Health Services in Moldova. She's co-authored several strategic normative documents and studies in the field of adolescent health and reproductive health, and is the principal investigator on a WHO international collaborative study of school-aged children. She's served as an international expert with major organizations like UNICEF, WHO, UNFPA, and GOPA, and is on the faculty of the European Training Program for Adolescent Health Professionals at the University of Lausanne. So great to have you with us, Galina. Thank you for being here. Next, I'm so pleased to introduce Brendan Hayes, who works at the World Bank's Global Financing Facility on sexual and reproductive health and rights. He's the focal point for what we call the GFF, the Global Financing Facility, for their engagement in Uganda, Ethiopia, and Afghanistan. And prior to his work at the World Bank, he spent 8 years working with Marie Stopes International, where he led private sector service delivery for sexual and reproductive health interventions. Brendan began his career working on HIV prevention and impact mitigation efforts in Swaziland, after which he lived in Malawi and is currently based in Kampala in Uganda with his partner and 2 children. Brendan has his BA and his bachelor's in history and African studies and his master's degree in development studies from the University College Dublin in Ireland. Thanks for being with us, Brendan. And definitely not least, but last is Adenike Esiet, who we call Nike. And Nike is the co-founder and executive director of Action Health Incorporated, which is a Nigerian nonprofit, and it's dedicated, its purpose is to advance young people's sexual and reproductive health and rights. Nike is a graduate of sociology and anthropology from the University of Nigeria, and interestingly worked as a journalist for The Guardian for several years in the 1980s. Over the last 30 years, she's contributed to building AHI, Action Health Incorporated, from an idea into a vibrant organization that combines community-based programming with national policy advocacy on behalf of adolescents' sexual and reproductive health and rights. She played a key role in mobilizing national consciousness around the development and adoption of the National Family Life and HIV Education Curriculum, which is currently being used in Nigerian schools. And I hope we'll hear a lot more about that today. She served on Nigeria's National Adolescent Health Technical Working Group and the International Working Group on Sexuality and Social Policy, and also developed international technical guidance on sexuality education with UNESCO and a team of experts. Nike is an Ashoka Fellow for Public Innovators and an inaugural Joan Dunlop Award recipient for outstanding work to advance the sexual and reproductive health and rights of adolescents in Nigeria. So as you can see, it's an all-star panel, and what a pleasure for me to get to facilitate this panel. And let me just put in one more plug. My understanding of these past conversations is that the chat area is really a treasure trove of your questions. We want your questions to help guide the discussion. Of course, we have some that will kick things off, but we will immediately start turning to your questions. And this is a great opportunity for you to get them answered by experts, so please take advantage of that. So let's start the conversation by really thinking about and hearing from our panelists what you all think are necessary components or activities or requirements for effectively scaling up an AYSRH program based from your very different vantage points and very different perspectives. So I'm gonna toss that question open and invite any of our three speakers. Perhaps Nike, you'd like to kick us off if you're willing.
Yes, thank you very much, Laura. Good morning, good afternoon, good evening, everyone. What would it be that needs to be taken care of if we're looking at scaling up an AYSRH program? I will be speaking to an area of interest of mine, which is comprehensive sexuality education. In Nigeria, we call that family life and HIV education. I think one of the key things to look out for in scaling up a program would definitely be to look at the different component areas of how a sexuality education program would be implemented. You know, you have to be thinking about training of teachers. Of course, there always has to be a policy in place. A program of this nature needs to be speaking to its values, what it's needing to accomplish at the end of the day. So a starting out place would be a policy that would guide programming. In the case of sexuality education in a country like Nigeria, we could only think about implementation at a national scale because there was a policy framework to work with. It would be important to then look at the different components of what that would be, like teacher training, access to resource materials for the teachers as well as the learners, mechanisms for classroom delivery and school preparation, as well as a system for monitoring and evaluation. So there's a way of getting feedback in terms of how programming is going, whether things are going well or not. I think I'll be able to expatiate on that as we go ahead. But a starting point would be to look at the different intervention points in whatever the service delivery to young people is about.
Great, Nike, that's so helpful to help kick off this conversation, because all of these areas that you addressed are ones that maybe not everybody who's implementing AYSRH thinks about. And that's exactly why we're having this conversation. And it's because scale up, like I said at the beginning, it isn't easy. and you really have a lot of juggling to do if you hope to be successful with scaling up. And your organization has really facilitated that process so beautifully in Nigeria. We have a lot to learn from it, and there's some nice papers out there that I hope can be shared with the recipients. So great. Dr. Galina, do you want to speak about this issue?
Yeah, I fully agree with Adenike. Because this is a complex of factors who can influence effectiveness of our program. And I will point also a few of them additionally. First of all, it's obvious maybe, but not always, to be evidence-based intervention, what we want to scale up. Because sometimes we have different experience for some screening, for example, program of testing girls in school for pregnancy prevention, but it's not evidence-based, let's to say, and to be evidence-based, to be proved already at the piloting phase from small scales, what it's effective. So this is important. Fully agree with need to have a supportive legal framework, norms, strategy, etc. And also one very important, especially in services, but everywhere, what we learn, one of the lessons what we learn, it's very important to have sustainable financing mechanism in place for this program. Before to scale up, we will return back. It's very important to have a good economical evaluation of the intervention what we want to scale, and to have some, because this is a good programmatic and also advocacy tool. Together with effectiveness. And also it's very important when we have some services in place, I will go also from part of user-friendly health services, to have a clear quality control system. Because what is working in a permanent way, this is meaning some supportive supervision, everything what it's meaning, first of all, quality standards, and all what it's all system what assure implementation, including not only curricula change in university or in college, but in place, in working place, collaborative learning session, supportive supervision session, internal audit meetings to address different aspects of quality and to increase this cycle of quality to keep. Also, it's very important from our lesson learned, communication about the program and promotion of the program. Advocacy with stakeholders, it's important, but also with community level, with community members, with beneficiary. They also should know about, I told about services especially, but this can be also, we have in Moldova experience with a very good program for life skills education, but not was accomplished by a good advocacy work and communication with community, and unfortunately was closed this program in 2005-6, 15 years ago, and it's take a lot of time to renew, and it's very difficult. And this is mostly, it's complex of factor in general, not only one, it's huge amount of work, surely.
Yeah. But you really complimented Nike's remarks so beautifully, and I think we're ready for you, Brendan, to come in, because Nike and Galina both sort of pointed to the need for financing to ensure that this is happening more widely. So that's one area you can address among whatever else you want to bring in.
Yeah, no, thanks very much, Laura, and really great to be here with you all, and really interesting, Galina and Adenike. Fully agree with the points that you're making. I mean, in some ways, it's like an impossible question to answer because the factors are so many, and the considerations, you'll almost never be able to consider every one of the dimensions that we've just laid out. But I will zero in on this kind of issue that Galina brought up about kind of sustainable financing. I think since I work for the World Bank and the Global Financing Facility, that's the role I'm intended to play in the conversation today, which is fine. I'm happy to do that. I mean, I think the way we have been approaching this challenge is to look at the role that kind of government systems can play in the scale up of adolescent health interventions. And I think recently was on a panel with Dr. Chandra Mouli, and he makes the case that for the past 25 years, there's been a lot of innovation in the adolescent health space, a lot of innovation, a lot of experimentation, mostly happening outside of government systems. And in some cases, that's happening for very pragmatic reasons. And really, a desire to be more innovative, perhaps, or to push the boundaries a little more than governments are sometimes comfortable with doing. But I do think that government systems and governments have a really important role to play in helping achieve scale for adolescent health interventions. And partly that's because they have a really important role to play in financing of services. And I think in most cases, and there are those out there that would disagree with this contention, but I think it's really important that we're thinking about delivering interventions that are free at the point of care in most cases for most interventions that I think are high priorities. And I think governments tend to be well positioned to do that. Now, obviously, it's not the only way to scale interventions. We have had lots of great success in public health from scaling interventions, primarily relying on donor financing. I mean, there are millions of people alive today because ART were made available through a combination of donor resources and price negotiations, and then over time, governments coming in. But that scale up did not start with sustainable financing. It started really ahead of having a lot of that financing lined up. And I think it's not inappropriate to be thinking like that. But I do think that as we're working on adolescent health interventions, thinking about how they would be applied or how they would be delivered through existing government systems is really important. And I think that's important because of some of the points that Galina was also raising about quality. It's not just about having an intervention that can scale. You need systems surrounding that intervention that can help support kind of continued quality delivery. So I'll pause there, but I think that piece is an important one to think about. Not always, not appropriate, obviously, for all interventions or all contexts, but I think that's a big kind of opportunity for us. I think it's an area that is unexplored in many countries, is how we could get government to be playing a more kind of robust role in this area. Thanks.
Yeah, thank you. I mean, I think that some of my colleagues from maternal and child health talk often about how government resources are an increasing share of, service delivery, covering service delivery in and of themselves without donor support. Now, the tricky part comes when it's addressing adolescents in particular, right? Because they can be a tricky population. It's kind of political and sensitive. And so now I want to get to some of the challenges, because I think this is where we learn, right? Brendan is pointing out that we really need to ensure this sustainable financing, and Galina is pointing out we need evidence. So even sometimes we have evidence and government may be resistant because of these sensitivities around scaling for youth, and they may be reluctant because of backlash or what have you. So I would love to hear from Nike a little bit about how you've been able to transcend some of this, because this is, instituting a comprehensive sexuality education nationally in Nigeria was really quite an amazing undertaking, and you must have learned a lot about the challenges that are posed in that process. So maybe, Nike, can you talk about the successes and maybe how you transcended some of those challenges, and then we can also just look at some of the challenges possibly.
So thank you. I started smiling to myself, and as you spoke about the challenges of working with young people, even if government is interested in funding, government would rather like to think about young people as asexual.
Yes.
And the programs we're advocating for young people are around sexual and reproductive health. So that by itself is an irony beginning, and For the work that's been done in Nigeria, there have been several challenges confronted because of this. The work in Nigeria advocacy started 10 years ahead of government ever acknowledging that there needed to be a policy in place. A lot of work was done in the late 80s and early 90s, up till 1999, when government finally said, okay, because of the HIV epidemic and the way it was affecting young people, that there needs to be a curriculum in place to address this in the education sector. Even though policy guidance was given, it didn't translate immediately to implementation, because we had to bring together all stakeholders, form some kind of agreement in going forward. And there are two issues I'd like to speak to that would be the real challenges. Brendan, spoke towards financing. That's been a real problem for going ahead with scaling up in Nigeria. And of course, the systemic challenges you may have, even if you have a good program that's ready to be scaled up. So I'll start with a good program ready to be scaled up. Policy guidance was in place in Nigeria. We had a good time with engaging different stakeholders in the education sector, within government and outside of government, that could be helpful. But there's still real issues. I'll give an example around availability of trained teachers. In a country like Nigeria, where we have millions of young people who are supposed to have access to this education, how do you go about teacher training? Because you can't do sexuality education when the people who are supposed to implement don't know the subject matter. Teachers are already in school, they don't have this background. So how do you go about it? That was the hugest challenge that we did have. And in that regard, training in sexuality education is not so straightforward. There are the issues, it's not just content and information. It's also about the values and the biases that the teachers bring to the table. How do you go about that? So there was a framework for training that was implemented at the pilot stage. When it became the time to implement, people started saying, so how do we bring teachers out of class for up to 2 weeks together and have them train? What happens to the kids in school? That was a huge problem. The resources that would make it happen, apart from the logistical challenges, were one, how do you get the resources to have teachers train over 4 weeks? Just about the time this was being rolled out nationally, we had access to the global, the Global Fund resources for HIV. And the knowledge that came behind that was to say, no, it's not possible to do this 2 weeks training. We'll just go on ahead, put this material into slides, have this training happen over 4 weeks, and discountenancing the fundamental issues around values clarification. Of course, that didn't go well at all at the end of the day, but it was a balancing act between what's appropriate to do and what kind of resources you can have on the table. So this is a kind of back and forth and managing of issues that really needs to happen. Then you have to think, there's several, and there are materials I can share after this that links to the several published case studies by UNESCO on how we went about doing it in Nigeria.
Yes, please share those, Nika. I think everybody would really benefit from learning more about the Nigeria experience. I think that the transition that you're talking about towards simplifying what was initially tested to make it more scalable, this is a very natural part of a scaling up process, especially when what was originally designed may not have lent itself to implementation in the larger system. And this happens often. We try to design things so they'll work. And we can say, yes, this works, but we don't necessarily design them in a very scalable way. And you really met that challenge head on you tried to figure out, well, what can be simplified? It sounds like what is not changeable. And even some things you felt were not changeable, like the values clarification aspects, still got dropped. And I heard you say something like, and that didn't go very well. Well, these are the things that can be a little, challenging in the scale up process. And we need to figure out, how do we maintain this integrity of this model as it scales? And for AYSRH, that is one of the most common challenges that we face in scaling it up. Let me give Brendan or Galina a chance to also talk about some of these challenges, whether there's simplification related, meaning quality trade-offs, or any other challenges that either of you would like to highlight.
I mean, I'm happy to come in, Laura, and then Galina can come in. No, Adenike, I think that's a really instructive example. And I think, to a degree, we have this idea that in the pilot phase, you're incubating the perfect intervention. You're incubating this thing, and then that is the thing that you will bring to scale. And I think the reality of most people's experience of scaling something is that it was like full of fits and starts and things that went wrong and had to be retooled. And I think that it's important to be like a little kind to ourselves, that it's very hard to anticipate everything that will go wrong. And but be like ready, have not only like the systems in place to understand when things are working or not working, but then also like recognize that you're going to have to be adaptive. Now, obviously, like that can only go so far. And Adenike, it'd be interesting to hear from you. Like, what was your impression though? Did you feel that the intervention was still effective, even though you had to make these adaptations?
I believe that to a very large extent, what was successful about it was the fact that the resource provided by that pot of funding actually enabled scale up to most states of the Federation that would not have happened without that funding. Funding up till that point had been limited to a number of private foundations who were interested, like the MacArthur Foundation, the Ford Foundation, at a point in time, the David Lucille Foundation. And the commitment of government was making sure that teachers will be accessible. Teachers are paid by the government in public schools anyway, so we never had to deal with the salaries of teachers. That's a huge contribution from government at the end of the day. But the scale that was provided by shrinking the length of time that was required and the kind of content onto the table was major, because there are 36 states in the Nigerian Federation, and implementation had only been able to happen with private foundation funding for about 8 to 9 states. So just about a third of the states were having access to what needed to be done. So to that extent, it was a useful enterprise. However, there are many shortcomings. You have teachers in the classrooms who have not dumped their own baggage, and they end up inflicting whatever limitations of their understanding of what sexuality is and what young people need to know on them. So you cannot say whether it's useful enough or it's not useful, but it definitely provided a groundswell of action that at least enabled the conversations to be broached with as many young people as we could reach in the country. We couldn't, that's something that any country would love an opportunity to have. And then as you went along and there were opportunities for refresher trainings, action being called into the field, more people were learning what they could not learn, more teachers were learning what they could not learn in the context of those trainings that happened for a shorter period of time. So that's in response to your question, Brendan.
Great. So Dr. Galina, do you want to weigh in on the challenges issue, or shall I move to another question about involvement, stakeholder involvement in the scaling up process? I leave it up to you. Do you want to tackle challenges?
Can add something shortly.
Yes, please.
In our country, one of we consider one of achievement. It's what state almost fully finance user-friendly services.
Mm.
They included in existing system of primary health care. This is like an open door in the system, these centers, and to adapt to face this challenge of patching quality when it scale up, we elaborate basic package of services and enlarged package of services to be adapted, to be even, for example, for family doctor, this is just friendly approach. If this is use clinic, this is a multidisciplinary team. This is more large package of services, and we organize our normative framework to be adapted. And one other big challenge for us is limited resources. Of course, Moldova is one of the poorest country in Europe, unfortunately, and even in this context, what we permanent evaluate service monitoring and evaluation, and also doing some repetitive costing exercise to use this data for advocacy for national budget and for some international donor. They support also. It's very important in Moldova. This is Swiss Cooperation Office, UNICEF, WHO supported us very much on technical issues like this shortly.
Great. Great. I think everybody's starting to grasp that successful scaling up experiences have some commonalities in terms of their breadth of, looking at the whole big picture and figuring out how to operate in the system, and really to mobilize that system, the wider education system, health system around the intervention package. So now let's talk a little bit about who should be involved in these scaling processes. I mean, you all have sort of hinted at these different stakeholders, but let's call them out specifically. And in particular, anyone and everyone who works on youth emphasizes the importance of the youth voice in these activities and in these processes. So maybe can you tell us a little bit about how you see the stakeholder engagement question and the role of youth in that?
If I can, may I continue? And this is one of the most important conditions for effectiveness. We don't mention, but it's because have a special question. Youth involvement. It's one of most important precondition to be accepted, to be affordable for this population, and without the active participation, it's not possible. In Moldova, in our program of youth-friendly services, since start, we developed a volunteering program of young people, and we even have few level of volunteering from very young volunteer till volunteer coordinator and volunteer peer educator and professional volunteers, to find to be also flexible. And it's very important to involve beneficiary. In our case, it's young people since planning, even name, even organization, even everything. It's need to plan to involve them in activity evaluation, and in even if it's possible, like volunteering, they, in our case, they participate in educational process, peer-to-peer, in promotion of the services, and consult us for many things in planning, in monitoring services. Of course, it's very important to have since start state authority. Without their support, at least more relevant, it's very difficult if we want to have scale-up program. It's very important to have financing authorities. This can be insurance fund, or it's very important to have such authority at the all level, permanent in monitoring, in reporting, not only when we ask money, but when we present, invite them in this process. And of course, it's very important to involve professional association, university, college, because one of big component to scale up to assure sustainability, of course, it's curriculum revision and assure training for long term. And in our case, especially, it's important to have parents or representative of parents as a member of community. And in our case, also, it's important to have representative of different NGO and even religious group. Because it's very important with adolescent sexuality. We have a lot of, or a big range of different, we have mostly Orthodox Church, but we have different movement religious, and they have different attitude. And it's very important to involve in many of them at the official level against, at the personal level, very often are very supportive. It's a different approach when we involve all of them. And this one of the big lessons what we learn in this, at least me, in this process, it's need to offer a lot and even to plan a lot of time, energy for advocacy with this whole range of stakeholders.
Yeah. Thank you. So either Brendan, Nikki, if you want to touch on this, otherwise we're compiling questions that are coming in fast now.
Okay. I think that Dr. Galina has done a good job of outlining the usual culprits, suspects, who you need to get onto the table. You want to ensure that you get on those who are supportive of the cause, who can make a difference, and those who can negatively impact the program. You don't want to look the other way. You don't want to develop a good program and find at the end of the day that people who you will call opposition in brackets, in quotes, would end up derailing the program. In fact, you may find along the way that the people who you think are the opposition may end up being your best allies if they get a better understanding of the program. So you want to definitely look to ensure you do that. And in the education sector, you want to be sure that it's not just teachers you're focusing on. You want to be looking at the education resource development material folks. You want to be looking at the school inspectorate, those who are responsible for quality assurance as programming is going on, you know, at the end of the day. But to speak more to young people, because I see the question, one of the participants, S. Mugore, asked the question, could I please share experience in getting participation and input from adolescents into a school system curriculum where the content has been predetermined and students don't contribute to what is being taught? I think this is a fundamental question. How do we ensure that the cake that we're baking for young people to eat actually deals with the requirements they have in their real lives? Because this is what sexuality education is really all about. It's the real lives of real people. What are their current experiences and how does our program respond to that? In Nigeria, we didn't have a chance to do that at the point of curriculum development. But as implementation went on, it became clearer that if we didn't get the voices of young people into programming, we will just be giving out what was not relevant to them. And a good opportunity presented itself as we looked at the deficit of materials for learners to use, because many times people are not paying attention to reading materials for the students. The teacher comes to school where in the education system, a lot of time is by rote learning. So it's what the teacher tells you that you write down and that becomes, you know, the encyclopedia. So we had this opportunity for us in Nigeria when we asked that, okay, there are no resources for young people that students can use. We need to have a handbook that each student has as the content. So in developing the handbook, what Action Health, my organization, ended up doing was to have young people as part of the material development process. This is the subject matter that you're going to learn according to the curriculum. What are the questions you would like to have answered? What kind of information would you like to have? So they influence what the content of the book would be. I'm happy to share a cover of the book with you. It's available online. It's the Family Life HIV Education Student Handbook for Junior Secondary School in Nigeria. And a lot of the material that they say our school books are too, are too, it's not interactive. So we have materials like comic strips in the book, something that's real to life, engages them. We have sections that speak to issues like, think about it. So there's reflection and critical thinking. Okay, so you are told that a boy has the same rights as a girl. And you're in a classroom and you can see that every time the teacher comes in, the teacher is only giving opportunities to answer questions to the boys.
Yeah.
In the book, it refers to stuff like that. Can you raise those issues in class?
Okay.
So the students have a resource that they themselves can, they can relate with and use it to ask questions because it's the approved textbook that the teachers have to give them assignments from. So there are different ways we can walk through that. Thank you very much.
Yeah, thank you, Nike. And I love the willingness to share that booklet that you all developed in Nigeria with other countries. So we are so close to time. I don't want it to end, but I do want to pose one more question that I'll start with Brendan. And it asks an interesting one about cost effectiveness. Like where are the most cost-effective places that governments could focus on to improve AYSRH outcomes? And that's considering the donor funded programs that are so diverse and there's different priorities among different donors. So maybe this is a big question for you to answer in just a few minutes, but give it a try, Brendan. We won't hold you to it.
Great. I think this is another unanswerable question, unfortunately, Laura. But I mean, I think it's partly because there's not going to be one answer. There's not just, it's going to be contraceptives or it's going to be, improving girls' education or whatever. I think it's very context specific, but I think you're hitting on a couple of key important points. One is that obviously, this is a country-led discussion because each country is going to be different. Number two, we have a diversity of partners and they're all investing in very interesting things. And I think the more that we can build consensus for context-specific high-impact interventions, the further we can stretch our resources. And I think that that's really important, especially in the current environment. I mean, we haven't spoken about COVID-19, but obviously a huge health issue, a huge economic issue, a challenge for adolescents and people of all ages. And one of the impacts that we've seen is a massive reduction in economic growth, real constraints in revenue for governments, reductions likely in health spending, and we've got lots of new competing priorities for donors that maybe traditionally were supporting AYSRH interventions. So I think the more that we can be aligning our work at country level and being guided by the principles that Adenike and Galina laid out very eloquently, I think the better. But I think that's really important that those conversations are happening. And we're not sort of spreading ourselves too wide and thin. That doesn't mean there's not still room for experimentation and for piloting and trying to push the limits. But I do think that as much as we can, building kind of a consensus and building a critical mass of resource behind some real evidence-based and high-impact interventions, irrespective of what areas those are focusing on, are really important. Thanks.
Yeah, thank you. And I think in many ways, it brings us back to how we started this conversation, which is designing for scale, right? So the things that Nike and the team were testing, the way that Galina was involving all these different stakeholders to help shape, and Nike too in Nigeria to help shape the intervention package so that it would be scalable. I think that's where the cost effectiveness comes, because if you design it for the system, And with the resources that exist in the system in mind, then you're more likely to have a scalable and cost-effective model. And so everything that everyone's been saying, all of these rich insights kind of all come together to help us know how to proceed. At the same time, we absolutely need to accept that this is not an overnight process. And that, I mean, Nike told us it took 10 years just to get the policy framework into place. And then that was what really opened up this opportunity. And we don't necessarily know in different countries what opens that policy window may differ. There are sort of movements in Nigeria where it was HIV, a rising prevalence and incidence of HIV really helped pop open that policy window. Somewhere else, it may be like Brendan is saying, COVID, and we're really recognizing the fragility of youth and adolescents in this environment, and we have to figure out how to navigate all of these things. I hate cutting this discussion off because it could go on for 2 or 3 more hours easily. But that's the beauty of this connecting conversation. It's really intended to be forward-looking. We want everybody to be getting their scaling up lenses on, like sort of wearing them in all of the work that they do and how they think about things in terms of advancing AYSRH. I want to turn back to Brittany, but before doing so, I really want to show my gratitude to the speakers and the organizers for bringing this session together and enabling and allowing me to facilitate it, and really thank everybody. So over to you, Brittany. Thanks, everybody.
Thanks so much, Laura, and thank you to our wonderful speakers. And thank you all for joining us today. Your questions were amazing in the chat. We will be posting and sending out a recording of today's session in both English and French. And we encourage you to follow FP2030 and Knowledge Success at the handles and websites that you see on the screen to stay updated on resources, activities, and upcoming events. And we hope you'll join us for our final conversation in the Connecting Conversation series on November 18th at 7 a.m. Eastern Standard Time, where we will explore building trusting partnerships with youth-led organizations, donors, and NGOs.
Brittany, before we let you go, can you explain to everybody how they might be able to access some of the materials that Nike mentioned, and hopefully the ExpandNet tools would be included too?
Absolutely. We will be writing up a recap of today's session to send out along with the recording links, and we will be sure to link any resources that Laura or Adenike mentioned during the session in that recap. So be on the lookout for that recap as well. Those will contain all of those lovely resources that I'm sure folks are very, very interested in. So yes, recap and recordings are coming your way.
Yes, and I regret that we didn't have a chance to answer enough of the questions, but let's keep the dialogue going however and wherever possible. Thank you, everybody, and good day.
Thank you very much for this opportunity. Good day.
Take care, everyone.
Thank you. Bye-bye.